This year we have the privilege of recognizing a practice in Calgary from which 9 member physicians were nominated for the Family Physician of the Year Award. And I think there's only 10 physicians at this practice, so that's pretty impressive. I could be wrong on the 10, but it's close to that, I think. 4 of those were in the top 5 of our Family Physician of the Year considerations this year. And this practice continues to be recognized by its peers and its patients for its innovative approach, forward-thinking approach, and medical home approach to how they provide care. So it's my privilege to award the very first annual Family Practice of the Year Award to Crowfoot Village Family Practice.
I'm supposed to be up here with my team that are sitting at the 2 tables over there, but really just this reflects all of the hard work that all of our staff put in behind the scenes for us, and how will they help us take care of our patients. So on behalf of all of us at Crowfoot Village, thank you very much.
All right, so for our last award, we go to the public. So our patients, and we ask for nominations for the Family Physician of the Year Award. So different than how we do the other awards, which is really our peers recognizing our peers. This is our patients that we go to for this award. This year, like years past, we were overwhelmed by the number of nominations that we received. I think we're up towards 70 again this year. And I want you to imagine for a moment what it would actually take to make you fill in a 3-page form that was saying something nice about somebody. So these patients did that. It's not a straightforward, simple form. It has a lot of parts to it, and we're asking for commentary. I can think of, getting these surveys by email or at a restaurant or in a store, and I can't imagine taking the time to do it. So to me, that just is testament to the amount of effort patients will go to recognize a family physician that means something to them. Congratulations to all the nominees this year. Many of you are here, and congratulations to all of you for the work, the dedication that you provide every day. I think we even have some previous winners in the audience, so I'd just like to acknowledge everybody here and all the nominees for this year. So this year's winner has continually been in our top 5 over the last few years, and so it's always a bridesmaid, never a bride, I suppose. But again, this year his nominations were outstanding. He's been practicing in Calgary for many years, been involved in teaching, in continuous medical education, public service with regular appearances in the media, advocating family medicine to the public. Balances work with a love of music and family, and he clearly inspires trust and respect in his patients. So one of the comments from the multiple nominations we received for this physician stated that he approaches his work as a physician from a personal place. He truly cares about the mental and physical well-being of his patients. Making our patients, this is me talking now, making our patients feel genuinely cared for, genuinely respected as people, and part of a home where physical, mental, and emotional needs are met is the challenge, is the goal, and is the reward of what we do in family medicine. And today I am proud and honored to acknowledge one individual of many who have filled this role. So ladies and gentlemen, please join me in congratulating this year's Family Physician of the Year, Dr. Ted Jablonski.
So when I was first asked if I would accept the award, I said, only if I get to speak. And I was thinking about this elaborate speech, and I thought, you know something, I only have a few things to say. Firstly, thank you very much. I'm humbled, I'm a bit embarrassed to be up here to accept an award for outstanding anything. When the day is done, I just feel like I'm just trying to do the best I can do. Just trying to do my job. And I'm sure we all think that in the room, we have the same sentiment. This is a testament, honestly, to how the health home is working, how medical home is becoming a home. If my patients think I'm doing a great job, it's because of the team around me. It's the staff at Crowfoot that are doing such a good, hard job. They're working very, very hard. They're very dedicated. My colleagues who cover for me, I take a lot of time off. I take care of myself, and my colleagues are there to help out always without much excuse. I mean, to the administration level of Crowfoot, to the PCN, more and more I've been involved in the admin of the PCN, just seeing how powerful it is. The MDT works so well. Patients feel so well when they're in what they feel is a home, and a home that cares about them and takes care of them. So if I get anything, any honor, it's a testament just to how the system is working when we put effort in, we really try to get it right, and I think we are starting to get it right. So I accept this award for all my colleagues, for all my staff, for everyone working around me. You know what else? I thought I've been in practice, well, next year will be 30 years for me. Despite my baby face, I've been doing this for a while. So I've been, sort of getting sentimental, thinking back to the beginning. And I thought back, I sit on, you're listening to family practice residents trying to get into the program, and you hear their stories, and some are genuine, some are rote, and they know what to say. But honestly, when I think back, why did I go into medicine? It's because I really love science, and I was very curious about it. And I was smart, and I could handle that. But I really wanted to help people, and that, it sounds, when we hear that in an interview, it's like, yeah, right, sure you do. But that's really all it was about in the beginning. And I look 30 years later, and it's still really all about that. So if anything, this is an honor to say, to celebrate that somebody can be doing this for 30 years and still really love it, really have passion for it. And honestly, I tell my patients this all the time if they ask me. They're always asking me if I'm going to retire. I don't know why, because I'm still in it for a little while. I guess because I keep buggering off around the country or doing things. But I say the day I wake up and I dread going into work is the day I'm going to move on and do something different. But for 30 years, I've never had that day. I just wake up and just very anxious to get in there and get working and helping people out. So lastly, I would just like to acknowledge my wife, Monique, who's here. Now I get emotional. So I've had many struggles in my life trying to be healthy, physically, mentally. She's been the rock. The rock for my family, the rock for me personally, to be here, to be the doc that I am, to be able to work so hard for my patients and to do the work that I was meant to do. So I acknowledge her and thank her. Thank you.